Good afternoon. I'd like to welcome you to Maintaining Strong and Healthy Latino Families in a Time of Crisis. My name is Janet Arias Martinez, and I'm Senior Director of Strategic Initiatives for CHCI, where I've served since 2013. I'm also a proud alum of our Congressional Internship Program. On behalf of CHCI, I'd like to thank Casey Family Programs for their generous support of this session. It's my honor to introduce you to this panel session chair, Senator Catherine Cortez Masto, representing Nevada. Senator Cortez Masto has spent her career fighting for Nevada's working families. During her time as Nevada's top prosecutor, Cortez Masto became well known as an advocate for seniors, women, and children. She worked closely with local law enforcement to keep Nevada's communities safe. Additionally, in November 2016, she made history by becoming the first woman from Nevada and the first Latina ever elected to the United States Senate. This panel of leading experts will discuss protective policies, interventions, and practices that can be put in place to promote agency, resilience, and recovery while strengthening vulnerable Latino children, families, and communities. To help us moderate this important and timely discussion, we have an anchor and executive producer of the Peabody Award-winning show Latino USA, Maria Hinojosa. She's also co-host of Endemic, Futuro Media's award-winning political podcast, where Hinojosa has informed millions about the changing cultural and political landscape in America and abroad. She's also a contributor to the long-running, award-winning news program CBS Sunday Morning and a frequent guest on MSNBC. Welcome, Maria, and thank you for moderating this panel of distinguished guests. I hope you enjoy this session, and don't forget to continue the conversation on social media using the hashtag CHCIHHM20. Now, Senator Catherine Cortez Masto.
Good afternoon, everyone. I'm Senator Catherine Cortez Masto, and I'm joining you virtually for today's panel. Let me first take a moment to thank our moderator, Maria Hinojosa, for her great work covering the impact of COVID-19 on Latino communities and communities of color as an author and host of Latino USA. I also want to thank our panelists and, of course, all of you for participating in this important conversation. Today the Latino community is facing an unprecedented public health crisis where pre-existing socioeconomic and health disparities have only been exacerbated due to COVID-19. Growing data is making one thing very clear. Communities of color are bearing the brunt of this pandemic. In my home state of Nevada, Latinos account for an incredible 42% of cases, and many are essential workers in the tourism, hospitality, and construction sectors who don't have the luxury to work from home. We know that the lack of health insurance, cultural and language barriers, underlying health conditions, and more contribute to higher rates of coronavirus infections in the Latino community. And let's not forget about those in our undocumented community who have been left to fend for themselves during this crisis. Many are scared to seek care, while others lack affordable insurance to cover health care costs. COVID-19 doesn't discriminate based on your legal status, and legislation passed by Congress shouldn't either. Yet recent relief legislation didn't do enough for Latino and immigrant families. Earlier this month, I visited an ICE detention center in Nevada to investigate reports of inadequate protections against COVID-19, which have become public as part of lawsuits against ICE. Over 5,300 people in ICE custody have tested positive for COVID-19. So I wanted to visit the detention center to highlight this administration's failure to protect those under their care and underscore the need for broader immigration reform. Not only is it in the public's best interest, but it's the right thing to do. Congress needs to do more. I've already co-sponsored and introduced legislation like the Community Solutions for COVID-19 Act to provide funding for community-based organizations with experience supporting the health of Latino communities. The Coronavirus Immigrant Families Protection Act to ensure that all communities have access to testing, public health information, and relief benefit regardless of their immigration status. Or even the Mental Health Equity Act that I co-sponsored with Senator Menendez to address the issues of suicide and mental health in youth in socially and economically disadvantaged communities of color. We can start today by passing these important bills. Our country cannot hope to get ahead of this pandemic without addressing the racial inequities that exist in how COVID-19 spreads and how we respond. Since the founding of our country, From the mass repatriations of Mexican Americans during the Great Depression to today's COVID-19 challenges confronting our community, Latinos have remained and still are resilient through it all. Thank you again for being part of this important conversation. We need leaders like you to help solve the social injustices that we face today. Stay healthy, stay safe, and enjoy the rest of the conference.
Hello, everyone. Well, abrazos virtually. What a great thing to be here at the CHCI conference virtually. I mean, of course, it would be so much better if we could be together. Thank you to Janet. Thank you to Senator Cortez Masto. I appreciate that. And I think we all know that no matter what your politics are now, this is an extraordinary moment for us as Latinos and Latinas, and not a moment for us to be taking any of this sitting down. We're going to be talking about just what the COVID-19 epidemic has meant for Latinos and Latinas. And we've got some really incredible and super connected people who are going to be part of this panel. Lina Guzman is Director of Child Trends with the Hispanic Institute. She's based in Washington. Michael Huesca is Chief Executive Officer of Paternal Opportunities, Programs and Services, on the ground right now on an indigenous reservation where he is doing frontline works. And Dr. America Bracho is Executive Director of Latino Health Access. I actually want to start doing this across the board. Lina, just tell me one story, and I mean literally in 20 seconds. I'm going to start with mine. I'm trying to get us to start by revealing a very deep and personal connection that we have, something that has stuck with us because of COVID-19 as Latinos and Latinas. And I just want to say I'm a survivor of COVID-19. So forever, I will be a survivor of this pandemic. And as you know, I'm Mexican, and many of my Mexican brothers and sisters right here in Harlem, New York City, the epicenter of the epidemic at that moment, were up and down delivering the food that was keeping New York City fed. That's very personal for me. So, Lina, how has it been personal for you?
Thank you, Maria. It has been very personal for me. I was raised in Queens and specifically Jackson Heights, so the epicenter of the epicenter back in March, April, May. All of those pictures that we saw in the newscast, those were of my neighborhood. Those were of my people. My family still lives there. And my extended family, has been fairly well through this all, but just today, my sister called me to tell me that she lost her job. So this has been very personal, and we, continue to be affected by it.
Yeah. Michael, what about you? Just one snippet of how this has touched you personally.
Well, first off, as the CEO of a father advocacy, it's impacted the fathers that I've worked with in a unique way. Many of them, half of them are still working, are frontline responders. The other half are not, and they are, really in a bad situation when it comes to child welfare because they need hands-on assistance to navigate through the system. So that's been a big challenge, and that's been very dear to me. It's being limited on my advocacy and support to fathers and parents in this system.
Yeah. America, what about for you? You are also doing frontline, but on a very personal level, what's something that has just touched you during this pandemic that you can't get out of your heart?
We work in the places where we live. So we have seen friends dying. We have seen friends losing their jobs. Many of them being evicted in spite of the regulations. We also have seen a lot of solidarity coming from people that have very little. So it has impacted me for the experience here and also for the global impact of this pandemic in many of our home countries.
And you're in Santa Ana, California. And Michael, you're right now outside of San Diego, right?
Correct.
Yeah. So, by the way, you can ask questions. As you know, with CHCI, the panels, the questions come at the end. But I was just saying, if there's something that comes up for you, and again, because I do want to talk about this person, we are talking about Latina families and how we're going to survive and move through this. So it is personal. And I'm just saying, if you want to add a question, please do. The drop down letter C. I'll be able to see this. I just want to say to the director, I'm getting mixed minus in my ear. So if you, that just happened, I don't know if you can block me because I'm getting an echo in my ear. So I'm just trying to understand, Michael, for example, lay out the picture for your community, what you were living through doing the work that you do, and how Latinos, in this case, fathers and families, how they were kind of faring under this administration with a whole series of issues. You're on the border, you're in San Diego. So kind of give us a glimpse pre-COVID, and then very quickly just shift to what it's been like post. And I mean, really just give us a minute because we want to go to everybody and continue the conversation. Go ahead, Michael.
So I will say that we are in a system when we're talking about child welfare pre-COVID, a system that was already not serving our families well. I absolutely believe that the system is a system of privilege that preys on some of the most vulnerable families. And so that being said, our Latino community is one of the highest rate of community for negative impact in the child welfare system. So what I see as a big challenge is, we're the way that we've cut certain fundings that were resources directly supporting our Latino communities. And I'll speak straight to the fatherhood piece. Fatherhood had gotten slashed in a way almost immediately during COVID. It went, let's go back to old behaviors of supporting programs that we know have, this, that, or the other to support it. And it was a huge impact on our communities. And that is one piece. The other piece I would say is the educational piece. I have fathers who have children who are far more along the educational resources and the education than they themselves were. And now we're in a situation where these parents are supposed to try and educate their children, and they don't
Wow.
have all the tools to do that.
Right. And America, me imagino de que what happens then, because we're humans, right? What ends up happening is you have parents who then feel like they don't know how to raise their kids. They don't know how to manage this situation. I mean, I now have 2 adult children living at home, so it's a very different situation. In some ways, we're kind of enjoying this very particular moment where normally they wouldn't probably be living here. But in terms of the family, I'm very interested in what you said, Dr. Racho, about how people have been helping each other. So if we've been hit so hard, can you paint a picture of what you're seeing in the area of Santa Ana, California? That is another response to COVID. That is, in essence, a response to what Michael was saying, which is the structural ability to meet the needs of this community. So what does the other side look at that? The community response, what does it look like?
And I will address that, but just going back a little bit, I want to share with our audience, because we are talking to leaders and young leaders, particularly. When all of this started, the data that was shared with people throughout the country and in Orange County was aggregated data, was the data about Orange County. We had data about cities, but we really didn't have data about the neighborhoods. And what happened with data, which is so crucial, is that if data doesn't identify what is happening in the neighborhoods, we become invisible. So what happened in this pandemic is that we were invisibilized as community.
From
And
the
the
very
pandemic
beginning,
started
uh,
from the
Dr.
beginning.
Bracho, You know what? What's crazy is, remember, it starts in California that we hear this. People are not necessarily making the connection to farm workers because we're hearing about actors and actresses getting COVID. And then in New York City, journalists were actually asking for the data based on race and ethnicity, and there was none. So the invisibility in the data was the first kind of sign for you.
Huge issue because it's not even is the data about race at the state level or city level, but the neighborhood was the one suffering. And because in our organization we work in neighborhoods, we started seeing people being sick and dying, and we didn't see the data that was corresponding with this reality. So we actually got organized to demand that this data was shared and published by zip code, which then was published on an ongoing basis. And today we even have the positivity rate by zip code. But when they first disclosed that, we were seeing numbers at the neighborhood level 4 times higher than the county level.
Wow.
And so we were seeing, because our community workers, our promotoras, actually live in the same neighborhoods. They were the ones saying, this is not what we are seeing. I mean, people are desperate. People, now they are working, so people are not evicted, but people are being evicted. A promotora told me of a family that was isolated in a closet because they actually live with 3 more families, but then they live with 3 more families because we have huge issues of affordability in the housing space. So so here you have a community that were living in overcrowded conditions, that couldn't stay home, that with a huge digital divide. Forget about, okay, telemedicine and all of that, without healthcare, afraid, with not trusting the system, and afraid because immigration, no healthcare connection. And now the kids have to stay home, do homework. I don't have money. I don't have savings. I mean, things got very complicated.
America, do you feel, I mean, right now you're talking to CHCI. Everybody who is attending this has heard this and knows this at some level. Maybe they haven't lived through it exactly, but they understand it. Did you feel like kind of the rest of the world when you were saying, hey, look over here? Were they looking? Were they interested? And I'm talking about your local media, your statewide media, the national media.
Right. Not at the beginning, but by June, we contacted the health department in a very organized way, and we demanded 2 things: that data be broken by zip code, and that a hotspot strategy needed to be designed to address these particular neighborhoods. And actually, we got it right. The school districts got organized, and the clinics and the nonprofits with the healthcare agency, and we started an initiative that is called the Latino Equity Initiative, and then started responding and hiring people from the neighborhoods and responding in very direct ways, but with a very intentional purpose of not only responding, but getting organized to fight beyond COVID.
Okay. So, when you think of how Latinos and Latinas have been impacted by this, and I'm just thinking about the traveling that I was doing right up until the quarantine started. So I was with Latinos and Latinas in central Mississippi, in the same community where the poultry plants had been raided. I was with Latinos and Latinas in Detroit, already kind of battling deep poverty. And I was in California, in Los Angeles, I was with Kat Von D, who's like the most famous tattoo artist in the world, and she's a Latina. So I was seeing different parts of how Latinos and Latinas were intersecting with this. Do you feel like right now, given that there has been, as America said, a kind of attention finally placed on this, that there is an understanding of the essentiality of Latinos or Latinas? And again, I want to remind people, 10 minutes until our Q&As. Submit your questions on the screen. It's under the C banner. And we're going to get to them. I'm already seeing some of your questions, so I'll be coming to them in just a minute. But is that something that you can address, Lina?
Yeah, I think that, going back to what America is saying, the programs, the community organizers have definitely been the leaders in many of this, and they've had to fill the gaps that our policymakers sort of left open. I really hope that sort of the nation as a country, we've awoken to the disparities that were in place at the COVID, and that really COVID has ripped apart. But it is really, right now, I think it's still very much at the neighborhood local level, and programs are doing, amazing, Herculean, efforts to keep their communities apart. The programs I've talked to really have had to, as Michael was saying, pivot away from necessarily the programs that they were originally providing, whether it was fatherhood or childcare or parenting, to meeting basic needs, food, getting food in the tables, getting hotspots to families, getting housing, rental assistance is another one that I've heard over and over again. Just getting families connected to those basic needs has just been an essential component of what so many programs have been doing in the country.
So,
and Maria,
yeah, go ahead, Michael.
I really want to bring in this point as we are talking about a lot of the national stuff and a lot of the different things. I want to bring it back specifically to child welfare. As I mentioned, in my opinion, the child welfare system is a system of privilege, and it does prey on the most vulnerable. During this pandemic, I have seen our families being separated. I'm not talking just about the current invisible families that are in cages, the children that are in cages. I'm talking about Americans that are here, that are Latinos, that are being separated and going through this system because COVID has brought on a new precedence for child welfare. And in my opinion, it continues to do what it was doing, and
Okay,
it
wait. I want
continues
to
to
stop
prey on.
you. I want you. Okay, so this is really important because I think what you're saying is that families are being separated, children are being placed into the foster care system because COVID-19 has exacerbated whether it's poverty, whether it's domestic violence, whether it's mental health. And so the term that you use for the child welfare system, a system of privilege, and that they're using that privilege to take children away. That's essentially what you're saying, that Latino and Latina families right now during COVID have less of a support system, and they're actively is that what you're saying?
Yeah, absolutely. Because even before COVID, Black and Brown families were the ones that are making up what's in the child welfare system right now. The children in care are represented in such a disproportionate numbers are Black and Brown children, right? And so it has continued, and I would argue that it is even more of a caution period to, well, let's remove this child. I heard of a case where a Latina mother was not willing to take her child to a doctor, even though there was allegations the child may have been exposed. And so they tried to petition to take this child away from the mother because she wasn't able to comply with going to get a doctor to clarify whether the child had COVID or not.
Okay, these are very frightening. And we are about Latinas that are at the most vulnerable end of things, more than likely continue to go to work, food on their table. I always remind people, somebody said something, the farm workers were working through the orange sky and how heroic it is. And I was like, you do understand they're Americans. Just like everybody else, they've got bills to pay. They're in debt like everybody else. They just don't get a paid sick leave. They have to go and work because we live in a society where that's the only way. We don't have the government support that says, oh, take some time off, which brings me to a couple of questions. So I'm going to put together these two questions. One of them is, can you talk about the positive influence and the limitations of the Family First Preventive Services Act and whether there's a possibility of building on that legislation? And then there's the question that you mentioned, Michael, I think, which is the question of learning in a virtual classroom. You know, I'm thinking about Latino families in New York City on the Upper West Side or Upper East Side who are wealthy Latinos and Latinas, and their children are being placed into pods and being paid high tutors to teach kids at home. I mean, it's kind of like, wow, this sounds amazing. That's not the way it is for other Latinos and Latinas. Who wants to talk for a moment either about the legislation or about how we manage successful teaching, maybe building on what we do well as Latino and Latina parents? But I think we're all being placed under the microscope of having to teach via Zoom, and that's the only way to teach. So who wants to take on that issue? America?
I think that Lina probably can talk more about the legislation part.
Okay.
The-
Oh, you're on mute, Lina. Unmute.
Can you
Okay,
hear me now?
keep talking. There you go. Yeah.
Okay. I mean, I think one of the places where we can build on from that policy is the prevention. And are we really serious about prevention? And in a healthy way, not in a stigmatizing way, not in that, you know, you're a Black or brown family and that you need to be sort of scapegoated, but rather really building off of family strengths. And we have many in the Latino community, as all communities of color, and really building on that and working, you know, from a prevention perspective about how do we, you know, build parenting strengths, how do we foster them, how do we encourage them, how do we provide the supports that young parents need, that parents in poverty may need, and how do we really do that in a way that, you know, doesn't end up with, you know, overrepresentation of Black and brown children in the foster care system.
America, maybe you can talk about the issue of education and how the parents that you're seeing, how this impacts them, that they feel that maybe they can't do the best job, and how that has a lasting impact on the family.
That's right. That's right. So, indeed, families have shared with us how much pressure they feel having to be the teachers now of their kids. And remember that many people in our communities have to continue working. So it's not like they are working at home and then helping their kids. They have to get out and bring the food. And they even say it's either I die of COVID or I die of hunger. So the choice is not there completely. So we are doing several things to help, and these are some of the ideas that you can contemplate. And one of them is to be with them. We believe in community work that we call in Spanish acompañamiento. We don't believe just in giving services, pero en acompañar, in provide that companionship that helps people navigate barriers. And this is not just one issue, it's to actually be able to talk to people and hear the many barriers. So it's not the same to help your kid doing homework if you have computers at home or if you don't, if you have a Zoom or not, if you are in the digital divide. We have neighborhoods that do not have good internet access. People don't have money to pay their phone, the internet bill. So sometimes they are victims of domestic violence. They are under a lot of pressure. Sometimes there are 5 people in a bedroom, and that in that bedroom the kid needs to do the homework. So it's not about one issue, but it's about providing that acompañamiento to navigate and not to solve the problems for them, but with them, because we have to remember that this is beyond COVID, that we have to build capacity for our communities to advocate. What is the root cause then? Why do they live where they live? Why they don't have access to internet? Why they don't know about computers? Why you have diabetes and you cannot do telemedicine? And so forth. However, with that said, schools are providing a lot of training for parents and the possibility of being person to person. And we are doing that to coach families on how to do this. We also are using other things like WhatsApp and Facebook to coach people on how to help the kids.
You know, one of the things, and then Michael, one of the things, because I'm like you, I'm a Mexican immigrant, so I never say no to work. So like you, I have 16 jobs. And one of them is that I'm a professor at Barnard College, my alma mater. And so I tell my students that there's nothing that I could teach them in terms of writing or literature or anything that we're studying that they're not learning from the challenge of living in this moment, and that it is going to teach us in the end when we survive that we are much stronger than we think. But this is a very, very challenging pill for parents to swallow. Michael, go ahead.
Yeah, I wanted to comment twice on two different things. One on the Family First Prevention Services Act. As a Latino, I see some different opportunities. Number one, Family First is going to bring a lot of opportunities for a lot of children in care. And I will tell you, if you're not familiar with the bill, it was passed in February of 2018, and it is a door open to a new way of doing things in child welfare. It's not the end all answer, but it certainly is a door open. And what I see as a benefit as a Latino is this is an opportunity for families to stay together and money to flow in to support services around parenting education, substance abuse, and mental health. In the old way of doing things, it was remove the kid, put them into foster care, and then services and money started coming. So I think that's really key. The other thing I will say, and going back to child welfare specifically, where we are getting hurt as Latinos, the courts, petitions are so far behind, and we have children being separated from families until they can get before a judge, and they're not being provided translators like they used to, because it is very difficult. It is very impacted. Some can't get on Zoom, some can't. And so I think that's a very big injustice that's happening to our children.
Wow. All right. We have some questions from the audience. Thank you. And keep on submitting through the C band of your questions. So I'm just going to read them all and then we can discuss them together. COVID is bringing on severe financial hardship for vulnerable families. What can be done that's looking forward to assist Latino families and workers? That's a huge question. I mean, I think we may have to see a change in the administration to have kind of that happen. But let's see. Other question, what are some steps that listeners can take to amplify the needs of their communities on the local, state, and federal level? So how to amplify the needs of Latinos, as America said, just kind of being very strategic about jalando de los pelos. And then finally, many of the families in our community are afraid to ask for help for fear that they will lose their kids. What are safe ways for parents to get the help that they need? So that was a lot. Lena, do you want to jump in first?
Yeah, I'll just start with the amplification question about there's two incredible opportunities that Latino communities, the Latino communities have in the next few months. One is the census, make sure that we get counted. Federal funding, the counts not only determine obviously our representation, but they also determine the dollars that go to states for important programs, including foster care, child health insurance, and other programs that serve our communities. And we projected that just a 3% undercount of Latinos would result in about 37 states losing federal funding for those important child and family programs. So make sure that everyone in communities, and I'm seeing this being canvassed in DC, in Queens, I saw that when I was there a few months ago. And the other one is that Pew is projecting that, 32 million, they're projecting that about roughly 32 million Latinos are going to be eligible to vote for 2020. And this is, another great opportunity to make sure that our community is heard and that policies, really are responsive to the needs of Latinos.
And I'm just going to follow that up on with this question for everybody who's watching, which I hope you know what the question is. What is your plan? And I'm talking about what is your plan to vote? My plan has shifted from doing early voting to now wanting to do in person and going out there at 5 o'clock in the morning and waiting in line. Anyway, it's nice to talk about our voting power, but what is your plan to make that vote heard? Michael, America, which one of you wants to jump in first?
I want to add a few things. See, I want to add a few things that will touch in several questions. As we think in what are the steps moving forward, I think that we need to understand what is the reality of COVID and what was happening before COVID. If we only talk about COVID, we will take the risk of not addressing the tremendous inequity that has been impacting our community. You were asking, Maria, you were asking about this, what we see, what was happening. We know what was happening. So we need to start talking about housing and healthcare and immigration reform. This is not just COVID, COVID, COVID. This is not a medical solution for inequity. And you ask, are people thinking in Latinos more as an essential group? I don't think so. I think that what COVID has helped us with is to make visible the huge inequity and the huge disparity and the fact, like the World Health Organization says, that no one is safe until everybody is safe. So going back to what is the plan and how do we think the steps, the first thing is to understand that we need data. And we need data that is disaggregated, not only on COVID, but data that is disaggregated in wage, in opportunities for housing, in education. So the issues of inequity need to be documented, not only at the large level, but at the neighborhood level. The other thing is that we need to engage the people impacted by inequity. This is not going to be solved by legislators only, by nonprofits, by schools. If we do not engage Maria, Pedro, Juan, the community people that are really impacted, if you don't sit them at the table, if they are not taking part of this, community will not trust. People are able to hear better when they trust the messenger. But also, if we engage the community in doing the plan, in understanding the data, like our community says, we might not understand your numbers, but we live the data. People know what is happening. So if we involve people in collecting data, understanding data, forcing that data becomes a plan of action, not only with COVID, again, with housing, with everything, that we force our counties and governments to focus the budget piece on data, that data guides budget, not politics and interest in the special sectors. That we actually have strategies to make that happen, that budget follows data, and then that we are organized as a community to put the pressure, because even if we have a lot of people, if we are not organized, we don't count. And again, with the community impacted at the center, so equity lens and this plan with them.
I mean, back to when I was a kid, an organizer in Chicago. Going to meetings back then, you had to take buses, you had to do this. In some ways, having political organizing meetings when you're at home is a lot easier. Michael, is it okay if I move on to the next question and ask you to opine in
Sure.
this? Because I actually think this is a really important question. I try to address it, whether it's in Latino USA or in my politics podcast, In the Thick, even in the book. In case you didn't know, I just wrote a book. It comes out tomorrow, Once I Was You. And part of what I try to even address in the book is a kind of a deeper existential question. America talked about resiliency, and I understand that, pero también estamos agotados, which is hard. So what is bringing you hope for Latino families during this time? And actually, we'll just go down the line. Lina, we'll start with Michael and then go to Lina. Michael, something that's bringing you hope for Latino families. Talk us up.
Well, the resilience is really the key. I hear about, I was a victim of domestic violence myself. I'm not a survivor because I'm a survivor of life. It is in my genes. It is in who I am, and I see that every day. Como Latinos, we get together, and sometimes just having somebody who understands what it is to be a Latino, right, and understands some of the challenges that we're having, I think is really huge. And we're seeing the unity come together. We're seeing the communities. We know our communities. We have those protective factors built in our own communities. The fact that we're starting to elevate them and we're bringing a light to them, I think that is really hopeful.
All right. I appreciate that. Lina, something that is hopeful for you.
I will echo a lot of what Michael said. I mean, it's really the resilience and the entrepreneurship of the families. Every time I go into Rock Creek, which is right here in DC, I can't tell you that it's our big sort of central park, but just much more nature. Um, every time I go there, I run into a quinceañera. You know, they're doing them outdoors. You know, they've got their hand sanitizer, they've got it all, but they're doing it outdoors. And that really brings me, you know, we are figuring it out. We're figuring out a way to stay connected, to celebrate, because, you know, anything this has taught us is that we have to seize the moment and celebrate when we can. And our communities are doing that. And I also, you know, when I went back to Queens, the entrepreneurship, you know, you can't have indoor restaurants. So we reconquered the streets and forget about parking, off street parking. Now they're just, you know, the streets are being used as areas where people can eat, and restaurants have carved out their little sort of fenced in area where you would have had two cars parked. You know, the people in the that call the empanadas in Jackson Heights are selling them, you know, individually wrapped so that nobody touches anything and everything feels safe. So I really, you know, the resilience and the entrepreneurship and just the desire to stay connected and finding ways to stay connected.
And I would say that actually each of us has the responsibility to kind of see that and call it out, to celebrate it, in, you know, whether you're talking about it with your kids or your clients, so that we're actually naming it for ourselves. Like, for example, I'm here in West Harlem, and I went to the bodega. It's a Yemeni owned bodega, but the guy who makes the sandwiches is a Mexican guy. And, you know, I'm a journalist. I'm often like, oh my God, things are terrible. Rah, you know, the democracy, rah. And I walked in and I said, oye, mi paisano, ¿cómo estás? A ver, el sándwich, no sé qué. And then I said, ¿y cómo te sientes con todo esto? Me dijo, bueno, you know, in Spanish, he was like, well, life is hard, you know, but better days are coming. Los mejores tiempos vienen. And I'm like, this capacity to be hopeful is such a part of la cultura. And I just wish more people would really celebrate that Latinos and our immigrant families tienen la capacidad to be hopeful, you know, the word resiliency, but also con esperanza y con ganas. America, something that you're seeing that is bringing you hope.
Thank you, Maria. In Latino Health Access, we have a call center and we have, 90 promotoras in the zip codes working with communities. So we hear all sort of stories. I'm going to just make comments in some of them. We have called people that are positive and we have said, do you need food? And they say, not now. My neighbors are cooking for me and are dropping the food outside my door. We have been bringing boxes for our food bank, and the truck comes with the boxes, and there we have little trucks from other cities where promotoras are coming from San Juan Capistrano to Santa Ana, which is a long distance, to pick up boxes so they can take it into their own neighborhoods. So it's like an army of little trucks waiting for the boxes to then go into the hoods, really, to help people. We receive calls of people that are, we have pañales, we have diapers. Do you have people that need it? And we have people that call because they need cereal. And then we have people that say, just call me. And we call them, family so-and-so needs cereal, need diapers. I'm on the go. They even put their own money sometimes. We have youth, that's my hope. We have youth from Anaheim Union, from the high school, getting organized to do a social media campaign. So we have volunteers, we have community leaders that are getting involved, and we have a community that is talking about change and not wanting to just go back to normal, but that are really understanding that they have the right to a better normal. And that gives me a lot of hope.
So how do we talk about, working with families, maintaining families? Like, right now, to be honest with you, I do feel safe in New York. As a survivor of COVID, I think every day I suddenly have a PTSD moment where I'm like, oh my God, I'm sick again. Oh my God, I'm sick again. Oh my God, this time I'm going to die. It's the PTSD with COVID is real. But I'm thinking about, going out to the park here in my neighborhood and seeing Latino families, whether son Mexicanos or Dominicanos, And there is a joy, like they're celebrating, they're doing a cookout, they're kind of doing social distance. But I have to be honest with you, there's also a part of me that's like, oh my God, are we doing something wrong? Should they be en un asado afuera? So help me to understand that. Like, also, kind of feeling like sometimes we are risky because, as we know, many of our communities say, no, pues lo que he vivido, o sea, un virus, apenas si me mata. You know what I'm saying? So help me to understand how we put those things together.
There are ways in which you can be in family and gather and celebrate and be at the park that are safe. And I think that the more people understand how to be safe and still gather, the better, because we are not going back. So if
So
you
what does
are
that
going
look
to,
like, doctor? What does
it
that
looks
look like?
like
Paint a picture.
it looks like a gathering in the park with carne asada and the family you live with, and then that same people that live with you outside, you don't need, you live with them, so the distance there and the mask might not be needed. If you're meeting with other members of the family that normally you don't gather, then you need the distance and you need the mask. But respecting the distance and the mask and the precautions, you can see your son. I saw my son, Maria, in a personal level that you will appreciate. My son and his wife at the park. He's a physician and he works at Hogue. And he is afraid that he can transmit the virus to me if he gets infected. But we saw each other and we kept the distance in the park and the mask. I brought my chair, he brought his chair, and we were able to talk about life for 1 hour. And I saw him and I cook for him, and then I give him the food and I say, I cannot hug you physically, so I'm going to hug you inside you with the food. And there are ways in which we can gather. What puts you at risk is to go crazy and think that this is gone, and then going in a party with a bunch of people that you don't know, that are not paying attention to their own health, and then becoming infected, infecting others, or dying, and then your family is going to really miss you. We say avoid gatherings, trying to be protected, trying to be safe, but there are ways of making it safe,
Okay,
and we
I love
have
that.
to be able to enjoy life.
Okay, so this is our last question, and then I'm going to give you an opportunity to kind of just sum it up for us and hopefully send us away with thoughts about what Latinos and Latinas are doing right, things we can look forward to. But before we get to that, and this is something very personal for me, I have 2 adult children, 24 and 22, and they are really, and they are privileged. They live here at home in New York City. They don't have to pay rent. They have jobs, but they are going through tremendous anxiety, stress, depression. And so what do we say to our young people? That would be a question that would be helpful to all of us. Just what do we say, Michael, to our young people who are feeling like, es que nada se mueve, I'm stuck, estoy estancado, I don't see a future. What are you saying to our youth?
Well, first of all, as Latinos, we sometimes we over communicate, and then other times we fail at communication, right? You know, and so I think this is the time where we really need to be over communicating. We really need to be talking and talking more. And it isn't something that we're always comfortable doing, but we need to be able to have conversations. They have to be those conversations that support our children and let them know it's going to be okay and we're going to get through this, and talk about where we've come from and where we're going. I think that's really important.
I'm going to use a word that I don't know who it was that said the acompañamiento, but that is because my daughter and I actually are started to do therapy to kind of work through some of the issues, which if you can, and you're privileged enough that you can work therapy into your schedule. And one of the things that I've started doing is to just acompañarla in esos momentos when she's very frustrated, or my son, just be there. Just be together. Maybe, let's make some popcorn and watch a movie and just be there. I mean, I ended up watching a lot of basketball with my son. I don't know anything about basketball. I know there's some kind of important tournaments that are going on, but I'm just kind of watching it to acompañarlo. So that's something. Lena, give us some words of wisdom about how to work with our young people right now.
Yeah, I mean, I would add to what you all have said. I mean, I think it's important to both validate, support, and validate. There are real concerns. We know from the research that children, I mean, youth who enter into the labor market during depression, recessions, it takes years to get back to where they would have been otherwise. So there are reasons to be concerned. But, do we, throw our heads into the sand, or do we, move forward? I'm always saying, we move forward, we find a way. So really it's about that, supporting the mental health, finding ways that you can serve your community while you're looking for a job, perhaps. Finding ways to network is another really, way that we can enter the labor market, especially for youth. So, I really do believe that, we need to validate, but also provide reasons for hope.
America, you have 1 minute, and then we're going to throw to our final comments. So your 1 minute help suggestions for our young people.
Right. And thank you so much, Maria, first for sharing your experience with COVID and your experience with your son. I do believe a lot in acompañamiento. Kids need a social life. So we need to talk about that. We need to talk about what is to graduate and not being able to have a party, not to be able to hug your friends. What does that mean for you? And we have to listen, not just preach, and we need to validate, but also we need to create opportunities for social life. And there are many that we can find with them. We actually have a hangout place where kids can do art and they do exercise and dances and music classes through internet. And again, it's not just about online. They could see some friends and they need to start learning how to be social, keeping the distance. In the moment in life, in their development, social life is critical. And just to say this will pass is not enough, but it's important to tell them that this will pass.
Oh my God, exactly. Okay, so we've got just under 6 minutes, and I want to give each of you just a minute or so to send us off. But I do have a question that just came in that maybe will impact some of your final comments. The question was, what do we say to stubborn family members who don't want to take precautions? How do you get to connect with them while still remaining inclusive and respectful? So as we wrap up and we think about, es que no todo mundo is taking this seriously too. So Lena, why don't you start with some final thoughts and send us off about, either the challenges or how you think that Latinos are already solving this.
Yeah, to go back to your first, what I have done is really reframe the question or reframe the issue, whether it's mask wearing, hand washing. These are all simple steps that we can all take to not just protect yourself, but to protect everyone that you love and care for. So I really reframe the question. And also, the power of seeing that, people around you, hand washing, masks, wearing masks. That really is also a really strong motivator. My sister just celebrated her baby shower, and I went back to New York for that. And there was one person who showed up without a mask, but we had disposable masks, and he did not complain as soon as we handed it over. It wasn't we handed it over, and it was clear it was not a question. And we saw everyone around us wearing masks, so we were very well prepared. I really want to leave with the message of both resilience, but let's not make sure we forget that we got here not accidentally. We had all the ingredients. Racial disparities, were real before COVID, as America noted, and unless we truly address the root causes, housing, unequal access to the economic, infrastructure, politics, etc., we are not going to, it's going to be a mini COVID year after year after year.
Wow, mini COVID. Michael, a few thoughts to lead us out.
Yeah, I would agree with Lena, making sure that you have accessible opportunity to help somebody, with the mass, I think that's a huge piece too. I think my grandmother prepared me very well for COVID. She used to have Lysol and alcohol, and she made sure, did you wash your hands? I don't care. Let me see you wash your hands, And so, those are some behaviors we've been doing for a long time. It's just reframing, as Lena said. What I would leave with you is the hope, because we have so many opportunities. We do have, as Latinos, we have a voice, and it's a matter of using our voice. We have all of the legislators that are on this call and the individuals who are representing us, and we are together. And we have to continue to really bring each other together, elevate each other, and hear each other as we are going through this struggle. We are resilient, tenemos ganas. Y cuando tenemos ganas, podemos hacer lo que sea.
Lo que sea. You just got to believe in those ganas. America, final
Yep.
thoughts.
Final thoughts. Well, first with the comment of the stubborn family member, I think that we first will try with love, and then we will be very assertive, and that person is about also my safety. So I believe that people that do not believe in masks need to stay home, and the people that want to get out, then they can use the mask, because nobody has the right to make other people sick. And in that sense, with a lot of love, we have to be responsible and show our boundaries. Show our boundaries. This is how it is. If it's not like this, it's not. And that has to do also with child abuse and alcoholism and many things. We need to show our boundaries. But my final message is to the many people in this institute today and the rest of our community. You are our leaders. You will have and have a lot of power and influence. My call to you is to multiply leadership, not to lead alone. Engage the community, multiply the leadership. When you multiply leadership, you multiply power. And we have to stop being afraid of the word power. We are powerful. And is that power the one that will help us not only overcome COVID, but rebuild better? So sí se puede. Sí se puede.
So that's an interesting, thank you, America, for that. In the newsroom that I created, Futuro Media, there are two words we don't use for sure. One of them is illegal, to refer to a human being, and the other one is minority. We don't use the term minority because I think that disempowers us. And Latinos and Latinas, we are not a minority. We have to stop seeing ourselves as a minority. And in the question of owning our voice and our power, that's actually what this is all about. That's what this book is all about. It's about the story of how we do that. And it's not easy. There's a lot of trials and tribulation in my own story. And by the way, I'm fine. It's okay. But it's more the fact that even as these successful Latinos, the imposter syndrome is nuestra sombra, always on our shoulder. And it's time for us to realize that we own this space. We own it, and we have to own it because that's our responsibility as Americans or as people living in this country, with or without status. So democracy is not a noun. It is a verb. It is something that we all do together. And so I'm so thankful to Dr. Lina Guzmal, Michael Semuesca, and America Bracho. Thank you so much for the three of you, for all of your work, and to everybody watching. Thank you again. And to CHCI, we've got our work cut out for ourselves. I really hope Latinos and Latinas, as America says, own our power. This is our moment. Muchas gracias. Have a great rest of your conference, and thank you so much.